much for taking the time to join us. From the Legislative Building in Regina, we have Minister of Health Paul Merriman and Saskatchewan's Chief Medical Health Officer Dr. Shahab. As well from the SHA, we have CEO Scott Livingston. We'll open up with remarks from Minister.
Good afternoon, and thank you very much for joining us here today. First off, I'd like to express my condolences to the friends and family of the individual that we lost yesterday to COVID-19. I'm going to keep my remarks fairly brief today. As I know, Dr. Shahab has a modeling presentation and some other information he wants to share with you today. I did want to say a few words about what we're doing to step up our testing and our contact tracing. I think by now we all understand the importance of testing and contact tracing in controlling the spread of COVID-19. The SHA has been approved to hire 76 additional staff to support provincial labs and have already hired 50 of those staff. The amount of testing has expanded as testing options have also expanded. There are currently test sites in 52 communities across the province, with 3 centres having drive-through testing: Regina, Saskatoon, and Yorkton, with a 4th one in Prince Albert coming online soon. GenExpert testing devices are available in 18 sites in Saskatchewan, providing preliminary results within hours. The SHA is further increasing testing capacity by introducing rapid point testing, best utilized for asymptomatic testing in our hospitals and our long-term care homes. When fully developed, rapid testing will increase asymptomatic testing capacity by up to 640 tests per day. Testing itself doesn't get the job done. You need the contact investigations that are triggered by confirmed test results. The SHA continues to improve its contact tracing capacity, increasing resources from approximately 60 trained staff to approximately 400. More than 20 provincial government staff have been redeployed and trained to support contact monitoring. And another 40 will be made available to assist with negative result notification and data entry. More than 80 University of Saskatchewan nursing students are supporting our negative callback center. The SHA is also working with the federal government to access federal resources to support our contact tracing, including approximately 30 to 40 staff from Stats Canada. Right now, every confirmed case in the province has an average of 11 close contacts. With a higher number of cases being reported each day, contact tracing is becoming challenging, particularly in Saskatoon. The next few weeks will be very important, as it is pretty clear now that this pandemic will only end when we have a widespread distribution of a safe and effective vaccine. There has been some good news about vaccine in the recent days, but of course, production and distribution of millions of doses that Canada needs is going to take some time. The federal government has secured an initial batch of 6 million doses to be delivered in the first quarter of 2021, 4 million from Pfizer and 2 million from Moderna. Of those, Saskatchewan will receive approximately 180,000. SaskHealth and the SHA are developing a plan to deliver the vaccine as swiftly and effectively as possible. The vaccine will be administered on a priority basis. I expect that we will be vaccinating seniors and frontline healthcare workers first. I look forward to the day when we have most of our province vaccinated, but that's going to take some time. And until then, we need to follow all public health measures and guidelines that will help keep us safe and those around us safe. And just a reminder, as of today, wearing a mask is now required in all indoor public places everywhere in Saskatchewan. Private gatherings in your home are now limited to no more than 5 people. And we strongly recommend that you do not have visitors from outside your household. And beyond that, keeping physical distancing, washing your hands, reduce the number of contacts as much as possible to limit your number of trips outside your home, and stay home whenever possible. These practices that are the bridge that will get us safely from now until the day we have a widespread vaccine. But we all need to build that bridge together. Dr. Shahab.
Thank you. Thank you, Minister. So I'll maybe just start off with a few general remarks and then get right into our epidemiology and modeling presentation. So first of all, I'd also like to join Minister Merriman in offering my condolences to the friends and family of the Saskatchewan resident who passed away. And again, our increasing deaths and hospitalizations again are a reminder of why all of us should take the simple actions we need to take to bring our COVID numbers down. So I'll be showing a few slides about our updated epidemiology that I've shown in the past, and then some updated modeling that has been shared in the past. But I would like to emphasize that really modeling, we have very talented and sophisticated modelers in Saskatchewan. We're privileged to have them, and they look at a variety of inputs to impute what may happen into the future. So it's not a prediction, it's showing some possible scenarios. And that, of course, is taken along with epidemiology, other factors by the Saskatchewan Health Authority and by government to look at, okay, what are some potential outcomes? What measures do we have to take today that could make a difference tomorrow? And of course, it also informs all of us that because ultimately what we do today starts changing the model, because the imputation is dependent upon all of our actions. And finally, I'll just say that the modeling I'm presenting today, the modeling has been running throughout the pandemic, and as right from February, and it's been predicting optimistic scenarios and pessimistic scenarios. Obviously, we didn't need to pay too much attention to it over the summer because all the case numbers are low, but the modeling was working very actively to inform us about the outbreaks in the Northwest and Southwest. So they did some very focused work in those settings that was informative in terms of planning. But now, of course, with the rising case numbers, the modeling is informing us of potential possibilities in the future. And right now, they're imputing all the measures that have been taking place about how those measures, if all of us follow those measures, can have an impact on our case numbers. So I'll also commit to bring that work in a week or two once it's ready to show how what we're doing is what kind of an impact that's having. So with that, I'll maybe just start with the slides. And so I just talked about a bit about the role of modeling. Sorry, so I just need to get used to the pace of this. So there's no, this is from our dashboard. What it does show is that what I've been saying for some time, that we had right to the left of the slide, we had a small spike in March, mostly international travelers. Then we had small spikes throughout the spring and summer, outbreak in the Northwest, outbreak in the Southwest. But obviously over the last 6 to 7 weeks, we can see a sustained increase throughout Saskatchewan, and this is really our first real wave. For many jurisdictions, it's been their second wave. For us, I would submit that this is our first true test, and we have prepared well, but we are now being tested both as residents of Saskatchewan, obviously the healthcare system, and other sectors, schools, other sectors that are impacted by COVID, and how we need to all respond to that. This is information is available on the Public Health Agency of Canada website, and this also shows that over the last few days, our active cases actually have become third highest in Canada. Initially, we were fourth highest for a couple of weeks, but now we are third highest in terms of active cases. And so again, the indicators are concerning. And this, for example, shows the rate per 100,000. This is the total for the last 7 days. So I think we just need to be careful that some of the metrics we use, we average for the last 7 days cases per day. But on some sites, you can see total cases over 1 week. So the numbers can be a bit different. But again, this also shows that, we're fluctuating between third highest and fourth highest in Canada right now. And these numbers can go up and down based on, how many cases do no longer remain active and how many become active. And this slide also shows something that I think is important, because what it shows is that if you look at all the 6 areas of Saskatchewan, and as you know, when we had our initial dashboard, now our map shows 13 geographies and 32 geographies, but initially we were just showing 6 geographies, the north, the far north, central and south, and then Regina and Saskatoon. So as you can see, we had the outbreak in the far north, so we saw that spike there, and then we had the outbreak in the southwest and central parts. We saw the spike there, and then when we had international travel, the bulk of the travelers were from Regina and Saskatoon, so a bit of a spike there. But now we are seeing a sustained increase, more marked in obviously Regina and Saskatoon, and also in the north, and to some extent far north, less marked in the south and central parts of the province, and part of it is related to population numbers, but definitely a sustained spike throughout the province. So again, our risk really is the same throughout the province. We can't say this part of the province right now is having a lower risk. This slide, I think, is really important, because what it shows is that if you look at our cases ever hospitalized and cases ever in ICU and number of deaths, we have had 229 people hospitalized, right through the pandemic, 67 in ICU, and unfortunately 32 deaths. And if you look at age ranges, we've had 6 hospitalizations and 1 in ICU under 19, no deaths. Thankfully, we have had 2 deaths in 20 to 39 age group, 3 deaths in 40 to 59, 17 deaths in 60 to 79, and 10 deaths in 80 plus. And if you look at our current hospitalizations, we have a total of 76, out of which 17 in ICU and 59 are in acute care. So again, we've had a lower rate of hospitalizations till about 4 to 6 weeks ago, but over the last 2 to 3 weeks, our hospitalization numbers are going up, and unfortunately our ICU admissions and deaths, and hence, a lot of concern obviously in the health system in terms of being able to ramp up and sustain this. And this again shows the same thing in terms of hospitalization and deaths following the rise in case numbers with a lag of 2 to 3 weeks, because generally, a lot of our increase in case numbers end October, early November were in a younger demographic, and it takes about 2 to 3 weeks for it to spill over into older demographics, and then of course a week or 2 for it to result in the need for hospitalization. And again, you can appreciate that this really is throughout Saskatchewan. Sorry, so this was the slide that I was speaking to, that this just shows graphically the increase in hospitalizations throughout Saskatchewan. This slide shows exposures by type up to November 15, and this really looks at exposures by type from November 9 to 15, just over 1 week. And I think this is important, because when we talk about 1,000 cases over a week period, that's sometimes more than 2 months worth of cases in the summer. So this can tell you about, if everyone has 5 to 8 contacts, about how intensive the case contact investigation now is. But we can see that healthcare workers, along with our frontline workers, are at risk, and some exposures may happen at work, some may happen in community settings. But again, it's a testament to the ability of healthcare workers to use PPE that overall numbers remain low. International travel is very small. Domestic travel this week was not remarkable. That has been there in the past, but again, cautions around avoiding all international and interprovincial travel as much as possible. We obviously have not had any transmission in the healthcare setting so far. In the past, we've had some transmission. We've not had large transmission now in communal living settings or congregational living settings like we had in the summer. Mass gatherings now is not contributing too much, because again, there's a prohibition against mass gatherings. We've reduced our gatherings in the home, so that as a contributor has come down. So that's good, but while that's good, we are still seeing significant transmission in other settings. So you can see that workplaces are contributing 8 cases the last week, household exposure in other social settings, public facilities, schools and daycares. And then the bulk of our transmissions, we are not able to identify the transmission chains. When you have a super spreader event, at least you know, okay, 200 people went to this event, 80 ultimately got COVID, and then they transmitted to, their household contacts, another 100, 200. Now, for most cases, you're out and about, but unless there's an outbreak, you can't reliably say that what was your source of exposure. So, and that number has been increasing, especially over the last 2 weeks. So again, that's something that we need to watch, and that's why we all need to reduce our number of contacts. We all need to examine where are we going. Is it essential? Stay home as much as possible. Go in a very dedicated way. If you're going shopping, try to go once a week. Grocery shopping, just one person. If you're doing Christmas shopping, try to go when there's less crowding. Plan ahead what you want to get, go and get what you need. Don't browse for a long period of time. All the behaviors we were exhibiting in March, April, we need to revisit. And I was saying that in March, April, our parking lots were empty in commercial areas. Now, if you see 100 cars a week ago, you really want to see about 25, 30 cars, which means you're going less frequently, you're going at different times of the day, everyone isn't going at the same time, because we need to space things out. It may result in the similar type of economic activity or slightly lower, but we need to space our activities out, and that's going to be really important. Outbreaks are just a small subset of exposures, but they are very important, because when we have an outbreak, 2 or more cases in a setting, it helps us understand what is happening. Was there lack of mask use, lack of physical distancing? And sometimes, everything can be in place and an outbreak happens, and that's called a super spreader event. It's just because we already know that you have to be 2 meters away, and then the risk is lower. But sometimes, you can have someone who's shedding a lot of virus, and the ventilation is such that, air currents can carry the virus further. So, but generally what we've seen is that, over the last 1 month or so, we've seen 5 outbreaks in assisted living home care. So very concerning. We would go weeks without an outbreak. So that's very concerning. 3 in group homes, 1 in a shelter, Lighthouse in Saskatoon, 5 outbreaks in long-term care facilities. And again, it's a testament to the excellent way in staff are managing that we haven't seen these outbreaks become large, and we know how challenging that has been in other provinces. But again, this is exactly the reason why our visitation policies are tightening up. We absolutely have to protect the most vulnerable individuals in long-term care, personal care homes, assisted living. And of course, it impacts the quality of life of residents in those settings. It impacts families who can't visit as frequently as they need to. But right now, for the next 4 to 6 weeks, it's imperative that we, kind of visit less frequently, try to reach out in other ways to prevent large outbreaks in those settings. Health facilities, 2 outbreaks. Thankfully, no significant outbreaks in community living settings. 9 outbreaks in the community setting, so they could be a variety of settings. And then 14 in non-retail workplaces. And again, we worked with the Ministry of Labor. They've reached out to workplace sectors just to make sure every workplace, small or large, public-facing or closed, has a COVID plan. And many workplaces do, but they just need to revise that, make sure that they're following those plans. People who were able to work from home came back to the office, can probably start working from home again. Those who need to be in office need to just be very meticulous about those plans. And this includes, how we behave during break times, mask use in common areas, cautions around carpooling, for example. Wear a mask and sit diagonally in a car if you must carpool. We've had 1 in a post-secondary institution, 3 in places of worship. So again, while most places of worship have been following the guidelines and have not had outbreaks, we can see every sector is contributing, cases, and through outbreaks we can see that the contribution is in every sector. So, events which may be a wedding or funeral, right now receptions of up to 30 are allowed, but this is a time to, have as small as a reception as you can, because we have seen 6 outbreaks in even weddings and funerals that were less than 30, 1 in a bingo hall. So again, cautions around those activities, physical distance, mask use, hand sanitization. If you're doing an activity, just do that. You shouldn't be eating and doing an activity. The food consumption piece should be totally separate. in retail locations, again, these were not necessarily involving customers, because we all know that set up really well, how we behave as customers and how the plexiglass and all that is, but sometimes it can be in staff during break time. And then we've had gym outbreaks, obviously 4, and that's why we're revising the guidelines. We already put in some measures around group activities. 10 linked to a restaurant or bar involving both staff and customers. Again, why this sector really, the guidelines that we looked at in some detail. And irrespective of the guidelines, we need to space things out. A room this size that could have 12 tables now maybe should have 4 or 6 tables active at a time. If you are going with someone who's not part of your household, maybe sit diagonally with almost 2-meter distance. I think we all need to think through that, and because this is going to be essential to reduce our transmission in all of these sectors, but especially some of the sectors where the risk of higher levels of transmission can be higher. And sports, again, we've had 8 outbreaks in sports. In many cases where someone plays a sport but also works in a particular setting. So in those cases, when you have a single case, all you can say is, okay, this person went to a restaurant, plays a sport, works in this kind of sector, but you can't pin it down. But the outbreaks do signify that sports do contribute a significant proportion of the total outbreaks. So again, all these sectors, so personal gatherings are coming down, large events are coming down, but all these sectors are contributing a small amount, and that all adds up to our 160, 170 cases a day. So we all need to look at all these sectors, and while the guidelines are being revised, we ourselves need to start slowing things down, go to take part in these events less frequently, and just be very thoughtful when we even go shopping, for example. Our testing numbers have kept up, and obviously you can see some day-to-day fluctuations due to weather or other factors. And sorry, I'll just... You can see some day-to-day fluctuations in the testing numbers, and also due to batch reporting, our numbers day-to-day kind of fluctuate. So again, from my side, I really look at averages by week, because in my view, that is really a more reliable indicator. And again, our weekly average has been going up. It's around 173 now. As a proportion of that, our cases per 100,000 is around 14 now. So creeping up below that 10 per 100,000. Our test positive rate is around 6.3%. So again, creeping up. So all these trends are still creeping up, and really want to see that turning around. And this was actually, currently in Saskatchewan, our daily case rate per 100,000 average over a week is 14.5. Active case rate is 146 per 100,000. Test positive 6.7. And if you look at the 13 geographies, it does fluctuate up and down. It goes up or comes down. Saskatoon is at 8.9, Regina 4.2. But at a smaller geography, it may go up and then come down on a day-by-day or week-by-week basis. But overall, our trend still is higher than we would like it to be. And then finally, before we get into the actual modeling slides, the reproductive number, obviously, if we did nothing, it would be around 4 to 5. Generally, we have, if you look at the top graph, so there's that kind of dial where we want it to be in the green. But if you look at the graphs on the right, the top one is Saskatchewan, where throughout the summer, we were mostly under 1, so 1 case is infecting less than 1 other person. But when we had our initially in March, we were over 1, because people are coming back. They may be transmitting to close household members. Then it became under 1. Then we had a few spikes when we had localized outbreaks in the northwest and southwest and other parts. But now, for the last 4 or 5 weeks, it's been sustained over 1 provincially. And if you look at it by the north, sustained over 1. Saskatoon, it has come up and down, but generally staying over 1 more than staying under 1. The rural south part, it's been doing better. Obviously, when we had the outbreak in the Yorkton area, it came up, but it's trending up again. And then Regina, of course, not as high as Saskatoon initially, but trending up again. So again, what it shows is that when we do have transmission, each person is infecting more than 1 person, and we really need to go under 1. And everything counts. Staying home if you're sick, getting tested, contacts need to stay home so that they don't transmit further, and then and reducing the number of contacts we have. So all these measures help in bringing the reproductive number down. So I did talk a bit about the Y model, and so I'll just start here. So the top slide shows the kind of peak and valley, peak and trough pattern. So that was what we were seeing in Saskatchewan, up and down, and the peaks are more localized. And ideal is we are in a slow burn, but if you can't maintain that, peaks and troughs which don't really go very high, you shouldn't really be hitting more than 60 cases a day, even if you're having a localized outbreak. So that's where we want to be. Right now, we're seeing a bit of a surge, the fall peak, and that's the second slide. But what we want to do is we want to manage this, and then we know the pandemic's going to continue till at least May, and then there'll be vaccine in the pipeline. Summer will come, and by next year fall, we may be in a better place. But what we want to do is, if you look at the bottom slide, we want to address this current peak and go back to either a slow burn, low flat curve, or peaks and troughs that are more manageable and don't need the same kind of measures that we are putting in place now. And this was kind of this is just an update of assumptions that have been updated on a monthly basis, and we have to remember that the worst case scenarios are still there even if you have low numbers. It's not that if you have low numbers you can say, oh, we don't need to do anything, because even with low numbers you can you still have to model for the worst case assumption. But what it shows is that you can, through fairly simple measures, bend the curve. And those simple measures are mask adoption, and they've put in 60%, but I would propose that if we have 90% people using masks at all times, that will bend the curve quicker, especially given where we are now. Fraction of population engaging in weekly gatherings. So right now no one is, but that does have an impact. Size of weekly social gatherings. So we are less than 5, and 0 if you already have 5 people in the household. But you can see how each of these things that is up to us contributes to, and small changes, like if we did nothing and stayed at, for example, personal gatherings of 20, we would rapidly start escalating. All of us doing these things, not just people who are over a certain age or people who have underlying risk factors. All of us need to stay home when we're sick, wear a mask, wash our hands, maintain 2-meter distance. Otherwise, we can't bend the curve. It's not just up to a few of us. All of us have to do it. As many people as can, if working from home, that contributes. I said in a parking lot, if you see 100 cars at any given time, you really want to see 25, 30 cars. And it may mean that people are going shopping or going to restaurant at different times or going less frequently, but in a more thoughtful way where you kind of get what you need in a more systematic way. And similarly, grocery store visits, go once a week in a more systematic way at times where it's not too crowded, then more frequently. And that's the beauty of modeling, that all of these small measures, when you add them up at a population level, it's almost too easy to achieve, isn't it? When you look at the optimists, right? I find it hard to believe that if you all do these simple measures, you can bend the curve. And I think that's the message we have to take home, that it really is up to all of us. So that's, I think, a key message. And of course, why it's important is because very quickly these numbers over time translate into, if you look at, on the left, the gray slide shows the planning scenario that was made in spring, which seemed, quite remarkable at that time. Then the green is where we want to be through those simple measures. But if we don't do them, then very quickly we can see an increase in hospitalizations, an increase in ICU admissions, and there's various scenarios that are being refined. And like I said, in a week or two, I'll present this data again, showing that with all the measures we're taking place, where are we now with the optimistic scenario? Because the higher we go the longer it takes to bend the curve and the more interventions you need to put in place. So now it may not be as easy as 60% mask use. It may be 90% mask use and other measures that may be required if we don't see a change in our case numbers. But I think what this shows is that cases creep up on you very quickly. So we went from less than 50 cases a day to around 50 to 100 to 100 to 150. Now in our third to fourth week, we are 150 to 200 cases. So things creep up very quickly. And then it's additive. These numbers just keep adding up, and then the downstream to that, hospitalizations and ICU admissions adding up. But on the other hand, when we turn things around, it still takes a few weeks for case numbers to go down, and then of course for hospitalization and ICU admissions to go down, it may take 4 to 6 weeks for that impact to be seen on hospitalization and ICU admissions. And this is what I will be updating. And this again is on the right side. It just shows our case numbers, average case numbers in the table below, just rising. We've been sharing that information. The graph on the right top just shows our daily case numbers, trending up. And then the scary picture on the left is what we need to pay attention for, because ever since March, we looked at the scary pictures and we felt comfortable that that's very important to be aware of, but we're not going there. And even with the localized outbreaks, we were hitting the upper bounds of getting into an uncontrolled state, but we were not getting there. Things would turn around, and we were confident because localized outbreaks, we understood the transmission. There was surge that would go there. Now, of course, what's happening is that we have transmission throughout. It's not localized, so our transmission chains are not well defined. It's people going about the regular business, and so contact tracing is very challenging. And the longer we stay in this, the longer it's going to be to turn things around. So if you look at these three stars are from November 8, 11, and 14. It does show that we are going up higher than our comfort level, and the modeling is being run as we speak, and I'll bring that next week and the week after, that we really want to see this bending down. And if it doesn't bend down in a week or two with the measures we've taken this week, we will have to think of other measures. But in addition to other measures, all the things I mentioned before, going less frequently for shopping, staying home as much as possible, wearing a mask when you're out and about, all those measures have a significant added effect, and we can't discount the value of those measures as well. And then these modelings are very complex, and they look at many inputs, and they are refined and to become more relevant for Saskatchewan. But then we are using, and the health system is using, what's known as a forecast. So that's a short-term 2-week forecast, and the blue kind of shows the confidence levels because it's just an estimate. So again, you can see that if we are at around 150 to 200 cases a day, that's the red dotted line. We really want to level off at 100 to at less than 200 cases a day, but if we were not to do anything, we can see that it's trending up to, in a week or two, to 600 cases a day or 1,000 cases a day. And, we definitely don't want to go there. We need to do everything we can to bend the curve. But it is showing that, the forecast is trending up, which all of us know in terms of from the EPI as well, but the modeling just confirms that we really need to take significant action so we don't get to where the forecast is showing. And similarly, if you look at hospital admissions again, and that this is obviously the concern for the Saskatchewan Health Authority and all people who work in hospitals, that this starts to show an increase in acute care hospitalizations and ICU hospitalizations. And again, if you track actual hospitalizations for the next 2-3 days, the actual hospitalizations are following the forecast. So that's why that shows that the way that the forecast is derived is accurate. But we still need to actually continue to watch, is it bending down or is it going up? So finally, I'll just maybe come to that initial slide that it's surprising how individual actions can actually make an impact, but they have to happen. We can't say that we won't make any change in our day-to-day life because everyone else is. That's not how it works. All of us have to make a change, irrespective of whether we're working from home, we're working in a specific setting. I think we do need to decrease our discretionary activities. I did say that if you're playing 3 sports, play 1. Even that, I think, see if over the next 2 to 4 weeks you'd rather do some conditioning exercises and maybe forego that sports activity. If you do go every now and then to a bar, restaurant, maybe go less frequently, go with a smaller group, go at times when there's less crowding, and those guidelines are being revised as well. Same with the retail activities, going shopping. Certainly support local businesses, but go in a more thoughtful way where you have a good idea what you want and you go and spend less time and get what you need and spend less time browsing. So all of those factors do have an impact. I think finally, right now, modeling and epidemiology and tracking where we're going is very important. And so I hope this is useful, and I commit to bringing some of this information back in a week or 2 weeks, and as frequently as required, just to maybe, discuss, are we headed in the right direction, and if not, what measures have we taken, what impact are they having, and if they're not having the desired impact, what other steps do we think we need to take? Thank you.
Thank you, Dr. Shahab. We'll now take some questions. Arthur?
This is for the minister. Just when we look at this table of modeling scenarios, it really drives home how stark the difference is between the pessimistic scenario and the optimistic scenario. And of course, some of the assumptions here have to do with restaurant and bar use, percent of people working at home, the kind of things that would require strong public health measures to achieve. And I'm wondering, when you look at that, and when you look at the potential number of deaths, the potential strain on the healthcare system, why don't you see the need to take the strongest measures possible in order to completely minimize the possibility of that nightmare scenario happening?
Well, thanks for the question. I guess from my perspective, we are moving in a direction. We're going on the information that we have on a daily basis. We're making the decisions that we made on Friday on information that was coming to us in that week. We made some major changes and some changes to the public health. That was followed up again by Tuesday with some more restrictions and some more tightening up of the specific areas that Dr. Shahab certainly described. It's very important that you can see the potential of where it could go in the worst case scenario, but you can also see the potential of where it can go if the regulations are followed. If the regulations are followed, Dr. Shahab has demonstrated that, and he's going to show that. The ones that we put in Friday and on Tuesday is going to take 10 to 14 days before we can see that actually has an impact on the numbers, because we're catching numbers in people that were infected a few days ago. So we want to make sure that those numbers that are going on an outward basis reflect what we are doing. We have the potential to change this and avoid the worst case scenario. And I think that we can. I'm very confident that the people in Saskatchewan can, again, if they're adhering to the specific rules.
You said that it'll take 10 or 14 days to know to what extent the current measures are effective. But we can see right here that the 14-day forecast alone leads to a very dangerous situation where we're getting as many as 2,000 forecasted daily lab cases a day in the very worst case scenario. And I'm wondering why we are even playing with the possibility of taking that risk.
Well, I would counter with that this is what you say will happen. I say that this is what could happen.
Why are we taking the risk when that could happen?
Well, I think that we put in some measures in place right now that are going to be able to do that. We've been looking at the information that's been coming at us on a daily basis and continuously adjusting what we are doing as far as public health measures. That has been continuing throughout since the pandemic started. There was major restrictions at the beginning, and then they lessened off. We reopened the province. We reopened our school system. We reopened the businesses across the province. So in saying that, I think it's very important that we are making those measures exactly. Like it's very easy to look back and say, well, we could have done this then, but with the information that we had at that point in time, we're making the best decisions that we possibly can. I don't know, Dr. Shahab, if you had anything to add?
Yeah, I think it's so if you take a long-term view, obviously no measure should be off the table, and they should be put in place at the right time for the right length of time. But I think I would say, obviously the next week or two is going to be critical, and if our numbers are trending up, then I think we will have to reconsider all measures. So right now there's consultations happening with all those sectors, which could mean tightening up guidelines, some voluntary changes in the layouts, which further enhances safety and reduces transmission risk, like for group activities, going 3 meters away, not stopping them entirely, but going 3 meters away and separating out. And so, but if that is not having the impact, and of course we've always said that the guidelines are there, and obviously business owners have to comply, and so do customers. But that still lets us do things that we value. But you're absolutely right that if we don't see a change in our case numbers, then we will have to go in a direction of more restrictions, which are hard for us as individuals, and it is hard for those sectors as well.
We'll go to Mark.
What's the current situation with capacity in our hospitals, and with these modeling numbers and what we're seeing over the next couple of weeks, how do we expect that to affect?
I would say that we're at a normal capacity within our hospital system, and I'll get Scott maybe to answer the specifics on this. And we're continuously adjusting that. If we have more patients coming in on COVID side of things, then that means we have to adjust down. We only have a finite amount of human resources out there to be able to assist any individuals coming into the hospital. But we have to continue balancing that. We don't want to start pulling back on surgeries if it's not needed. We still want people to get their surgeries in time so they can maintain a healthy lifestyle and for the benefit of their mental health. We're going to continue adjusting that throughout, and that adjustment and that balance that we're going to find is going to be on a daily basis to be able to see, do we need to adjust things in Saskatoon? Do we need to adjust things in Indian Head? What are our options of being able to make sure that the system is running at its maximum capacity, but dealing with what is specifically in front of them? I don't know if, Scott, if you have anything to add to that?
Well, I think just to reinforce, Minister, that the comment you made about right now the hospitals are busy, and in particular our tertiary centers, Saskatoon and Regina, but we know in Saskatoon there are a number of units that are experiencing significant pressure, particularly our ICUs in Saskatoon. That's why they're on bypass. But part of the role is that we're still, at this point in time in the pandemic, there's that dual responsibility where we're taking care of both COVID and non-COVID patients, which is where we want to be, and we don't want to see a wholesale closure of the services to those people that are not experiencing a COVID diagnosis. But at the same time, we have that ability, if we need to adjust services based on what we're seeing with the COVID pandemic. At the same time, we're looking at our capacity as a single organization. We're looking at our acute care capacity across the province. So yes, we're under pressure. Yes, there's some safety valves that we could use, but they're not ones that we want to pull the trigger on just as of yet, but we will adjust our services as we need to support our COVID response. And if we need to build capacity like we did in March by reducing some of other services here and there for short periods of time, we'll do that. And in fact, part of the revision to the surge plan, in April we released our COVID surge plan, and we're reviewing that and looking at the new data. And it includes those options around what we can do to expand capacity on the defensive side, but also how we support the offensive strategy.
Follow up, Mark?
Yeah. At what point would the field hospitals come into play in that situation?
We have various steps to be able to get to that point. The field hospitals are, as far as I know, physically ready. But again, we have to resource them. So we have to pull the individuals out of the current hospital system to be able to put them in the field hospital to be able to do that. So from my understanding is that the field hospitals would be used, but only if absolutely necessary. But that's why we built them, is to make sure that we had that final pressure area that we could release if need be. I don't know if, Scott, you wanted to add anything?
No, I don't. I think you answered exactly how I would have.
We'll take a question on the phone lines.
We have Connor O'Donovan with Global.
I guess I'm just wondering why. I think Dr. Shahab, you said that you expect the vaccine in and around May, which I guess is right after the 6-month period for which these scenarios are projected for. So why do you say that, or why do you think that vaccine will come in May, I guess?
Yeah, no, so I'll just clarify. So I think right now we are in a state of sustained transmission, and we've always said that when we go into the fall, when we are indoors more, we have to take extra precautions. So we were all predicting a fall surge. We didn't see it for quite some time. Now we are definitely in our fall surge, which, again, is our first wave, our first true test province-wide. Obviously, we've been tested in different parts of the province before. And this caution, because we are indoors, all the measures we have to take all the time will have to continue until May. After that, summer comes, we can do more things outdoors, and we may get some respite. And of course, if our numbers are surging, we may need to put in place additional measures. But around vaccine, I think I didn't want to give that perception. The vaccine pipeline will be, is getting more and more clear. We already know that there may be vaccine available, a limited amount available starting January, February. But then, the vaccine pipeline will continue throughout next year, throughout 2021, and we don't know the details of how much vaccine will be available beyond February, but it will be coming in smaller amounts, and obviously we hope that there will be a national approach of prioritization about who should get the vaccine first. Obviously, we're looking at emerging data on how effective the vaccine is. Early trials show that it's highly effective, and indications for use, and so we would hope that as the vaccine becomes available in 2021, starting in January, February, people at highest risk are first in line to get the vaccine, and people who provide services to people who are unwell, including frontline healthcare workers, would also be front of line. But some of those details will depend on what we see as the pipeline. So we'll start in a limited amount. We hope January, February, but then we don't have good visibility of what the pipeline will be through the rest of the year, and that will continue beyond May. I anticipate that the vaccine pipeline will continue into the fall.
Follow-up question, Connor?
I guess these scenarios, I guess they depend on public uptake of the health measures. Is there any kind of information out there that suggests people start paying more attention when we see a certain number of cases per day, or a certain rate per 100,000, where people really start to take this more seriously?
So my cutoff for sitting up and paying attention is 5 cases per 100,000, and which is more than 60 cases per day. So whenever you start getting into the range, we all should sit up and take notice. And of course, anytime you're above 10 cases per 100,000, that's for us in Saskatchewan, more than 120 cases a day, I think you need to, of course, all of us need to do all the things we should be doing all the time, but then you need to slow down your activities, which now, like I said, go less frequently shopping, go less frequently to other public settings. We already, significantly reduced gatherings in the home, significantly reduced visitation to long-term care. But beyond that, other specific measures become critical. So that second kind of threshold for me is more than 120 cases a day. And now we are averaging for 2 or 3 weeks now well above that, 150 cases 2 weeks ago, and then around that 160, 170 range last week.
Go back to the room. Steph?
Yeah. Minister, when this pandemic first started in the springtime, the language your government was using was the goal was to flatten the curve. Now it's bend the curve, we want to plateau. So why is the goal no longer to flatten the curve?
I would say that the goal has always been to flatten the curve. And I don't think that we've moved away from that. We're continuously, the restrictions that we put in place last week and this week are all there to be able to flatten the curve. The whole point of everything that we've done since this pandemic has arrived on our doorstep is the reason that we were doing the flattening the curve was to make sure that the healthcare system wasn't overwhelmed. That was the first and foremost point of flattening the curve.
To be fair, Minister, the restrictions the government took in the springtime to flatten the curve were nowhere near that same level. So I don't think you can honestly say the goal here is to flatten the curve, because we're not taking the same level of interventions.
Well, I think when we were in the springtime, there was a lot of unknowns at that point in time. There was unknowns about how fast we were looking at, as Dr. Shahab had mentioned, the modeling that was coming out of Wuhan. We were also looking at the modeling which was coming out of Italy and some other jurisdictions across the world, which were very scary. We know more about the illness right now. We understand we're on the precipice of a vaccine, which we had no idea how long a vaccine would be. And people are starting to adapt to how to manage their daily lives around this vaccine. So the goal is still to flatten the curve, to make sure that the healthcare system is at a place where it's manageable and we can continue to accept patients and we don't get overwhelmed.
By rejecting calls for this 2 to 3 week circuit breaker or shutdown or lockdown, there is an inherent risk that this virus is going to continue to spread in higher numbers. Like in the springtime, when everything was locked down, we didn't see a heck of a lot of transmission. Now with more things open and people being able to gather in others' homes, we are seeing this virus spread. So why does your government accept the risk that this virus is going to continue to spread and more people will become severely ill?
Well, I think the Premier mentioned on Tuesday, and Dr. Shahab just certainly, I heard it today, saying that everything's on the table. We haven't made any final decisions. What we're looking at is continually to find that balance in between what is our healthcare system can handle, what we can keep our economy and the jobs as many people employed as we possibly can, which also leads into people's mental health. With a complete shutdown, it's very challenging for people to deal with that twice in 1 year. So we're continually adjusting our restrictions and our guidelines to be able to make sure that we're finding that. That's why we're working with the associations, we're working with the businesses and the other organizations to make sure that we can find that spot where it is. And obviously, since the beginning of last week, that spot's moved. That's why our restrictions have continued to move, is we're continually adjusting to be able to make sure. Is there something in the future? I can't tell you that. I can't tell you what's going to happen in the future, but I can tell you this. If everybody adheres to the guidelines that are set out, we've got a better chance of maintaining what we have now or opening things back up versus going the other direction.
Take our next question. Adam?
One of the main criticisms of the current restrictions right now is that people think it's contradictory that they can't have people in their home, but they can go to a bar. I know the Premier said meet a friend at a bar or restaurant, sorry. We don't have anything coming on that. I know you're talking to those industries, worship services, sports. Where is that at, and what can you say to people who think that this is contradictory when we don't know? We have 1,000 pending exposures right now, according to this chart, where those could be happening in some of these places that don't have restrictions right now. So what's your message to that criticism? And I would ask both of you to answer.
Go ahead, Dr. Shaw.
So my message today is actually we need to slow everything down on our side. And I think that is essential. And I gave the parking lot analogy that, parking lots were empty in March. They were full, over the summer and early part of the fall. But if you go to your favorite shopping mall or restaurant area and you're used to seeing 100 cars, we should see 25 cars there. And we need to slow things down, go less frequently shopping to a restaurant. And I agree that, if you want to have that get-together, think very carefully. Obviously, home is not possible right now. Even at another setting, if it's your close household members going out for a meal, that's safer. If it's friends and family who are not part of your close household, even there you need to maintain the 2-meter distance, and it'll make for a very big table for people to sit 2 meters apart. But those principles need to apply in all settings, including in a restaurant. And I think we just need to take that to heart. And I think the next 2 to 4 weeks we need to be extremely cautious. But then if our curve trends down and we come to that, ideally less than 60 cases a day, then we can again start relaxing a bit, because ultimately that's what it'll have to be. We tighten up a bit, bring the numbers down, bend the curve down, and then my comfort level is below 60, but certainly below 120, and then we can start easing off a bit. But that's how it'll have to be, unfortunately, throughout the winter.
Minister, what's the update on on the consultations, and what can you say to people that are concerned that this is contradictory advice?
Well, I don't think it's contradictory. I think this is many steps that we've put into place. We've seen household transmission numbers go up, and that's why we kind of targeted in on that area and reduce. And you saw the sheets that were out here. When we keep reducing the household contacts and we abide by the masking rules, it brings our numbers back into check. We want to make sure that the tendency when you have people over is you want to have your neighbors over one night, and then you want to have some family members over the next night. And if you want to have, another different set of neighbors over the night after that, well, now you've got multiple points of contact in that. Whereas if you're going out to a restaurant or something like that, it's a very focused, and I'm going to go to the restaurant with this individual, and that might be the only outing that I have this week. The tendency in human nature is to invite people over and be friendly. We're from Saskatchewan. We want to be with our neighbors, and we want to be able to converse and find out what's going on in their lives. But we've seen the contacts, certainly the infection rates going up in the household, so that's why we've protected against that. And again, these measures will stay in place as long as the numbers remain high, but if we do our part, the numbers will start to turn, and we can look at options at that point in time.
The advice from Dr. Shahab seems to not jive with what is being done as far as the measures go. So he's saying we should see less people, we should go out less frequently, but there's still opportunities for people to go to an event, go to a concert, for example, where they can have food service, go to church where there's a large numbers, go to a bingo hall, go to a casino. Are these things, are you contradicting the doctor in these cases?
No, all of our guidelines are done in consultation with Dr. Shahab. We're not out making guideline recommendations without Dr. Shahab and his team having a close look at what we're doing to be able to find out what it is. The recommendations come from Dr. Shahab and his team, and we work with him to do what it is that how we can get this out, how we can make sure that people are adhering to it, how we can get it communicated through the media, and make sure that we're getting accurate information out to the people, because there's a lot of misinformation about this virus out there, and we want to make sure that people are being advised of the facts about this and why we're doing it.
We'll take one more question on the phone.
We have Britton Gray with CJME.
We're seeing more and more healthcare workers get sick with COVID-19 as they become more exposed to the virus. Is this concerning just due to the fact that we are seeing our hospitalization numbers also rising rapidly?
So maybe I'll make some initial comments, and then maybe Mr. Livingston will have some comments. So obviously we know that from day one, healthcare workers have been there for us, and like Dr. Shaw said eloquently, we have to be there for them. So that's number one message. And number two, we also understand that with, use of appropriate personal protective equipment, healthcare workers have been able to minimize to a large extent exposure in the healthcare setting, but it is still an ongoing risk, especially when, you may not have, be expecting someone with COVID to come in a healthcare environment, not just the hospital setting, but primary care. So all those sectors where you provide healthcare or personal care now need to be extremely cautious and revisit their protocols and the use of appropriate personal protective equipment. But in addition to that, just like everyone else, we are out and about and also get exposed in the community setting. But I think all those things are important, and if required, we can present further analyses by occupational group if required. But I'll just see if Scott, you had any further comments?
Just to add that throughout the pandemic, it is one of the metrics we've been monitoring, and I don't think you're seeing a trajectory any different than what we're seeing in the community. And just like Dr. Shahab has said many times, when we see large uncontrolled spread in the community, we're going to see changes in spread in schools, we're going to see them in healthcare facilities, and we're going to see them impact healthcare employees, physicians, just like we would anybody else in the community. And the only thing I would add is, this is one of the major concerns that we would have as a system, particularly as we go into, seeing the case numbers we've seen recently, and without the public's help to help control the spread of this disease, and in particular control the number of contacts per case. 11 is way too many. We're putting the risk of the healthcare system at stake, not just because of patients getting COVID, but because of healthcare employees, physicians, and all of our staff being at risk of being infected, and that reduces our ability to properly care for patients.
Have a follow-up, Britton?
Is there maybe a reason for why we've been seeing higher hospitalizations? Is it just because more people are getting sick, or are people starting to maybe feel even stronger symptoms due to this virus this time in the fall?
So my initial assessment is that the COVID virus has not changed, but obviously as it infects more people, even though initially it was in the fall is infecting more young people, but as we saw, even in the younger age groups, we unfortunately have seen hospitalizations and deaths. They're less common, but the more people you have who get COVID, even if it's a smaller proportion, you do see the impact. But also, obviously, there's always a spillover to, people who may be older, and hence the caution around personal gatherings, the caution around, visiting our friends and family who are more vulnerable in assisted living, long-term care, personal care homes, and also the caution around, all of us, wearing a mask, maintaining physical distance, and those who are more vulnerable being especially careful and thoughtful when they're out and about and thinking of going to a restaurant or other such setting.
Perfect. Thanks so much, everyone. That's all the time we have today.